10th, 2024, at 7:34 a.m. And could we please have the roll call, Ms. McDonald?
Mayor Slanka?
Here?
Mr. Richmond?
Here.
Ms. Sipsey?
Here.
Ms. Cash?
Here.
Dr. Zollett?
Here.
Ms. Lawley? Here. Mr. Bonnell?
Here.
Ms. Miller?
Here.
Thank you. Next item on the agenda are citizen comments. I don't see anyone here, so I think we will go ahead and go on to the next one. We have 2 public hearings today. So the first public hearing, MBHE ordinance number 2024-01 for food fees. Do we have any discussion?
We've not received any comment in reference to the proposed food fees from any citizens or businesses.
Okay. And do we want to go ahead and have a discussion about it right now? We haven't received any comments, but do we just go ahead and speak about it currently amongst ourselves?
There's not much to say, is if they raise the rates a little bit.
In the state.
That's it.
Okay.
No complaints?
No complaints, nothing. One thing I do want to mention is the law department did make some verbiage some changes, just some clean up the languages a little bit from the first reading. But other than that, there's no changes.
Okay. So at this point then, I'm sorry, I have to apologize again. I have all my notes in my computer, which is locked for some reason, so I really don't have my notes to speak to things. But okay, so the next step would just be to go ahead and vote.
No, I think we voted this is just the open.
This is just
This
the
is just a
public
hearing,
hearing.
you know,
Okay.
the public hearing.
Yeah.
Yeah,
And
we usually
so then
vote.
we vote on the
Yeah.
agenda.
Oh, okay.
Yeah.
All right, so then, if there are no more comments for or against, then we can close this public hearing, is that correct? Okay, and then we can move on to the second one. Second public hearing, which would be for MBHE ordinance number 2024-02, pool fees. Have we had any correspondence from the
No
public?
correspondence or comments in reference to the swimming pool fees.
Okay. Is there any,
Oh, and similar, just, I wanted to mention, the law department just cleaned up some language from the first reading to the second one. So.
anything of note?
No.
No, okay. Is there any discussion for or against this? No? Okay, well then, at that point, we will go ahead and, we will close that public hearing as well. At the next item on the agenda is the approval of the minutes from August 2024. Do you have a motion to approve the minutes?
So
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion, any changes? Okay, hearing none, we will go ahead and vote on the approval of the minutes. Ms. McDonald, could you please call the roll?
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
The yeses have it, and the motion is approved. Next item on the agenda is to receive and file a financial report for August of 2024.
Yes, and then what do we have it up through, Amanda, now? What was the last report? Because it seems like the finance is still entering in revenue, is that correct? And so, do we have it up to,
The end of July is where revenue is entered, and then, I'm sorry, expenses are current through the end of July, and all revenue is entered.
still having some, I don't know what happened, we were caught up and then,
Yeah,
did Sam, any other additional information?
they just said that they were working on, that they had been getting everything caught up, and that hopefully it's headed in the direction that it'll be caught up, but they're still entering in the expenses.
But we are still, on track with our finances, everything still looks good, so. I just wanted to bring that, if you guys are comparing some of the numbers or whatever, cause if they don't get it, up to date, whereas expenses and revenue, it could look off, or else the next month it should catch up, but I'm just bringing to attention when we see it, not all the way through the end of the month like we used to, we're just, but we have enough money. The bottom line is our money is trending, still, we still have kind of spent maybe about a little less than 60% of our budget, so.
I had a question, I don't know if this is the proper time to ask it, it was about indigent services.
Yes.
Is this the proper time? So it looks like we're over about, I can't remember, $1,800 in August of our budget for the year. So if we trend this way, we should go over by about, what, $12,000 or so?
Possibly. I had mentioned to this acting city manager, Nathan Cahill, that may be happening. That does not come out of the health department's budget, it comes out of the general fund. It is trending up. No one has insurance. We've even had a couple of complications lately at a local nursing home that are just sending, people to the crematory and not doing the process of the application or anything. So we're trying to work that out. But the way it looks, unless something changes, they'll just probably have to increase that line item.
That's what I was thinking, so that discussion's already been had?
Yeah.
Okay, because, is this the first year that that's happened like that?
We've had them trend up before like this. This has been it's been a problem before, and then it'll go back down, then it becomes a issue again. But just to know, I think when I called Hamilton, Hamilton's not, the only other city is Hamilton City that's like our size, that has indigents pretty much, and that has some of the issues that we have. They've had, I think, 15 to 18 to our 35.
Wow.
So it's like, so it's a little more. She really presses them. We were saying that they need to have record of that they're indigent and all of that. Some people cannot find any record of it, anybody's finances. I mean, and everybody says they're homeless. Everybody says they've been in Middletown for years, and I mean, we could hold them out forever. Funeral homes become upset if they have the bodies there for a long time. Coroners do not want to pick up anything that's not a coroner case, and everything, I mean, so when they die in a nursing home, even after being there a week, it's not a coroner case, and so they don't want to pick it up, and so the nursing homes don't want to hold on to the body. It becomes really complicated, so.
Yeah, and we were talking about this a while ago, a couple months ago, it sounds like, so, okay, so basically, we just have to, that conversation about increasing the line item.
Right.
That's about what we can do.
Yeah, so what we're gonna do is last year, try to get an average of, at the end of this year, average of how many we see, and then times that by the 755 or whatever, and try to at least put that much in the budget, and then we'll go from there.
And you mentioned how Hamilton keeps it down, what do they do?
They're just not easy to work with.
Oh.
So they really make them get all the information in.
Can we, I mean, is that something that we can look to, is that a possibility for us, or what would that look like?
It could be, but it's just hard. Sometimes when people don't have it, they just go ghost. I mean, families that just go away, and, I mean, we could do it, but I mean, we could try to be
Is that a staff
harder.
power issue? Like, we don't have enough staff to do that, or what's the, yeah.
I think it becomes legal issues, like are we harassing the family? Do we have the right to do it? I mean, what was the other one that I think,
The problem is, where's the body gonna go? Like, if the coroner's not taking it, the person died in the nursing home, funerals can't take it unless they know that they're gonna be reimbursed. So then the nursing home doesn't know who to call, coroner absolutely refuses. So then
Kind of leaves us in a bad
something
place.
has
Yeah.
to happen,
Yeah.
yeah.
Okay.
I think at larger cities, they have a larger city morgue that they can hold the bodies. Hospitals have some space in their morgue. I know we had one person that came to us, the person died in December at, what it was in Miami Valley. Someone over the holidays off vacation forgot Grandview or something. We got the body in March.
Wow.
Yeah. Yep. And so, yeah, I know, right? So,
Seriously.
and then the son just came back looking for a dad
Oh.
a couple weeks ago. So, I mean, it can become hard. I think the son ended up being incarcerated or something, so he didn't know. It's just like, it's kind of hard,
Wow.
so, yeah. So hopefully we'll get something like a streamlined process. I don't know, I think the coroner and Cindy Hogg from Hamilton City, Eric Balster, the health commissioner in Butler County, is not really involved because it's on the city's municipalities, so it's not county, it's not a county program. So she was saying that maybe we can get together. Dr. Manick said that she could do a little in-service as far as what bodies they like to pick up. You know what I mean? Because if it's not a coroner case, so that goes back to all the nursing homes. And last but not least, the nursing homes, usually, a lot of our nursing homes here have indigent, clients. They are indigent, and so there's nowhere to go. Normally, in the perfect world, you would want a patient in a nursing home to say who their pastor is, who's their church, and have all their insurance set up so that when they pass away, they look in the records, they find out, call pastor so-and-so, and call funeral home X, and they come and pick them up, and it's pretty smooth. But in this case, a lot of people that are in nursing homes anymore are, very poor.
And maybe don't have the family around
Right,
them.
especially certain nursing homes around here that are taking people with drug, issues. And you guys know, you've heard of that. I mean, it's a lot of nursing homes that, take clients that are, extreme abusers of opiates and et cetera. So they're pretty sick people that are in those nursing homes, and so.
So it sounds like we're gonna look at the line item, but also there's this possibility of speaking with, Ms. Hogg and Mr. Buster about maybe streamlining our process to try to do what we can to mitigate. Okay, all right.
Now, the other thing, and Jeff may know about this, I don't know if the state has started to open up their reimbursement, because we used to get reimbursement from the Embalmers Association, but that money comes and goes, and last we heard, they didn't have money, but they may have opened up. We have Stephanie looking into that, the Embalmer Association, I guess, remember they had
That
funds?
was the state board.
The state board, okay.
Yeah, they had $1 million. Funeral homes only applied for half of that, so they did away with it completely.
Wow.
So, yeah. And another thing they were talking about, Kentucky, when we listened to that webinar, Catholic Services does their whole indigent program in the state of Kentucky. So everyone is buried there, and they have this big, robust indigent program, and it's for the whole state. It was pretty interesting, kinda. It was long, it was kind of, but, someone was saying that, long-term care facilities, since they have clients in there, they may be able to, since they make so much money too, they may be able to start a fund, like an indigent fund, for their, clients there. Because there has to be a lot of people that pass away with money in their fund, and or have unclaimed different things, so it was talked somewhere in the atmosphere about that too.
Those Catholic Services?
No, that's nursing home, long-term care facilities having the
Okay.
responsibility maybe to make sure if their clients that they have for a long time pass away, will they be the ones responsible for the indigent? And if that's the case, they can do a round robin and send them to the funeral homes and just, take care of that service.
Okay.
So,
Something to check
more to
out.
come, yeah, but so more to look into.
Thank you for taking the time to explain that.
And remember, this was Laura's program, and so Stephanie is just trying to get up to speed to do some of that. So between Amanda, Stephanie, and I, we've been kind of pacing it together to try to find out all that information.
All right. Okay, any other discussion about financial report? Okay, so we just need a motion to approve. Is there a motion to approve the financial report for August 2024?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? We will proceed to vote. Ms. McDonald?
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
The yeses have it. The motion is approved. Thank you. All right, next on our agenda is our education presentation by Dr. Jenna Wine for mosquito-borne illnesses.
Okay, good morning, everyone.
Morning.
So, we kinda did this last year, but given the news that's been out, at least catches my attention, I'm maybe more of a nerd on this stuff than others, but there's been a lot in the news lately with, Dr. Fauci getting, West Nile and, Eastern equine encephalitis in, Massachusetts. August and September are usually the biggest months, so I thought, well, let's kind of revisit this a little bit today, so. The lovely topic of mosquito-borne illness. So the biggest components are protozoa, which are single organism, kind of a step above bacteria. bot flies, helminths, those are parasites, and then viruses. Viruses are really the big one in the United States, although we can get protozoas, malaria, but that's usually a travel thing. But viruses are really the ones that the United States sees that are contracted here in the United States. So viruses are the West Nile virus, the Zika virus, the chikungunya virus, equine encephalitis, St. Louis encephalitis, dengue fever, and lacrosse encephalitis. Protozoa, again, malaria. Last year, if you guys will, we'll talk about the big malaria. So those are really the big ones that we hear of, see in the news, and have some exposure to here in the United States. So transmission, of course, is the mosquito bites an infected animal, a host, who can then transmit it. So the mosquito becomes infected and then moves to the human or any other animal and bites that animal, transmitting the virus or protozoa into the new animal. In most of these issues, the human is not a ongoing host, so we do not then spread that virus to the next mosquito that bites us to then spread to another human, except for malaria. Symptoms, pretty non-specific usually. It's kind of the typical flu-like symptoms, so you get fevers, achiness, fatigue, headache, neck pain. If you're getting into significant neural competence issues, you're gonna get confusion, delirium, and even coma. Death, of course, rare, very rare. So West Nile virus is what Dr. Fauci got. Unfortunately, my map is cut off. I don't know what I do wrong with these things. For some reason, I always lose that right edge. West Nile virus is by far the biggest one in the United States. The mosquito-borne illnesses typically ranges anywhere from 7,000 cases to 10,000, 700 cases to 10,000 cases a year. The 10,000 cases was the second year that it was found in the United States. So it was highly tested that year. Everybody was looking for it. Had these huge, relatively speaking, big numbers. Probably still similar numbers, just nobody's looking for it as much as they were. So you get much smaller numbers. This year so far, as of yesterday, there were only 355 cases, even though it seems to have gotten all this attention. Again, most of Dr. Fauci was in the hospital. So in most cases, it's asymptomatic. The majority of people hardly know they had anything. If they do, they just kind of thought it was a 24-hour bug and don't even seek medical care. It can affect humans, horses, and birds. Birds in particular are the real host that can continue to transmit it on. Humans and horses are a dead-end host. The mortality rate is less than 1%. Most people do very well, even those who get neuro involvement. They can wind up in the intensive care unit, they can become very ill, but typically they'll recover and do quite well afterwards. So Eastern equine encephalitis, triple E, kind of what you'll see it called, EEE. Fortunately, it's very rare. It again hits humans, horses, and birds. It tends to be the northeast, so you've got Massachusetts, New Hampshire, Vermont, a little bit of New York. This year, even New Jersey had one case. And then it jumps to the Great Lakes. So you get Wisconsin, Illinois, Michigan can occasionally get a case or two here. They're usually pretty small outbreaks, although Massachusetts has had outbreaks up to 40 in a season. Again, it's hit the news a lot. It's a very high mortality rate, 30 to 50% mortality rate if you come down with Eastern equine encephalitis. So again, kind of the news media has been on this one this year because there were 2 cases in Massachusetts. I didn't really put it together, but Massachusetts, parts of it are apparently quite swampy. And so you get their cranberry bogs and those things. And so they get the brunt of it usually. One small community has 2 cases. One person died. And so it has raised quite a bit of attention, even though I think it was 2018 that they had 40-some cases. So this is a relatively small outbreak, even though it's getting a good bit of attention. So in the US right now, we've had 6 cases in 5 states, with 1 death, as of yesterday, 1 death and 1 in critical care. The Zika virus. Zika virus is, again, not typically really transmitted in the US, but we do hear occasional outbreaks of it in the US. Really aren't an outbreak here. It's someone who's traveled to the Caribbean, Central and South America, and have contracted it there by a mosquito bite and brought it back. Again, usually mild or no symptoms for the majority of people. It's really not a significant disease per se for most of us unless you are pregnant. If you're pregnant, the virus can be transmitted to the fetus, which again, unfortunately, my picture is cut off, and leads to microcephaly. So the baby, if the viral infection is early enough, the baby's head does not form properly. You get varying degrees of microcephaly where they essentially have a small head, small brain, and it really is the brain. So the bottom half of their face or skull looks normal, but they have a very small brain, very small top of the head, and can clearly cause significant lifetime developmental delay and problematic issues with baby. I have a hard time saying this one always, but it's chikungunya and the dengue fever. Two separate viruses, but they're very similar. Again, very rare in the US, usually travel related to the tropical regions and subtropics of Northern Africa and parts of Asia. Again, usually a very mild, non-debilitating illness. People get over it very well. It has an extremely low mortality rate, again, except unless you are pregnant. It has a fairly high spontaneous abortion rate if you're pregnant and come down with either of those viruses. So pregnant mothers are really the biggest concern in those cases, traveling to those areas of the world. Malaria, it is the protozoa one. Plasmodium species is the causative agent. It again is a fairly high mortality rate if it's untreated. Treatment is key to this one. All the viral ones, there really is no treatment except supportive care. With malaria, there are good agents. There are some regions of the world that are resistant to some agents. There are still agents that are effective against pretty much all of the malaria species. So treatment is available, and it is key to get to it quickly. And as it says, it has a 20%, up to a 20% mortality related death and 600,000 deaths worldwide. Pretty much all the cases you hear of in the United States are travel related here also, except last year we had 8 cases of US transmitted malaria. So people had been in other countries, came to the United States, had that scenario talked about, they had the protozoa in them, got bit by a mosquito here, transmitted it to the mosquito, who then transmitted to another human. So eight people who had not been out of the country that contracted malaria in the United States. So far, there have been 0 this year. Treatment, again, I kind of got off there. Viruses and supportive care, IV fluids, medications for fever and aches and pains and things that just try to ease their symptoms, or if they're sick enough, they go into intensive care and can manage with IV supportive care. Malaria, again, you've got oral and IV medications. You do have to watch for resistance, but most of the time we're using the newer agents that, if I've never had to treat it. In medicine, you're using newer agents that are beyond the resistance so far, but it has to be quickly obtained treatment to be effective. Thanks. Oh, the last thing, of course, is prevention. That's the biggest thing. You know, across the United States, prevention of mosquitoes is really going to prevent your mosquito-borne illnesses. So we can't necessarily get rid of the virus, but we can hope to reduce the number of mosquitoes that we come in contact with. So draining standing water. You know, most areas have become pretty good with this. Eliminating swampy areas, at least in your backyard and areas that people are going to frequent. Cover your doors and windows, have screens to, again, prevent any kind of pests from getting into a house or a building. And then mosquito repellents. DEET's been the long-standing one. Came under a lot of fire at one point and was kind of trying to be pushed to get rid of until the West Nile virus came about, and then suddenly DEET was the best thing since sliced bread again, and has been still kind of the stalwart of mosquito prevention. Picaridin is a newer agent, quite effective, if not more effective than DEET, and seems to have a lot less concern and worry with absorbing into the skin and the effects that DEET could have used in high frequency. So There are two very good agents. Some of the other ones we all hear about, what's the one product, I can't think of it now, but it's out by one of the beauty agents and, you know, it's supposed to have, yes, supposed to have some, none of those others are recommended because they're just not effective enough. So they could have some repellent effect, but not enough. You know, the candles and citronella, again, they might reduce your numbers a little bit, but they're not really gonna protect you from a bite. These are the only two really recommended agents to prevent any mosquito bites. And that's my presentation.
Thank you very much.
Any questions?
Um,
Dr. Fauci is home and recovering well.
He was pretty sick, wasn't
He
he?
was pretty sick, yes.
I did have a question about West Nile. Where is that located in the US?
That was on my map.
That was the map.
It's pretty well across the United States, but it is sporadic. So this year in particular, it's pretty much all of the mid-plain states, but it's particularly heavy across the south. But up the North Atlantic and here, I mean, it really, depending on the season, it's hit pretty much every state except Alaska. So it can be anywhere, but different seasons are a little bit different variation. But it's national.
Thank you very much.
And then environmentally, they test mosquitoes constantly. They trap them and test them to see if they're here. And if they are here, then that's when you start saying that West Nile is in our area, but it doesn't mean it's in a person, it's just been found in a mosquito.
And every state in the United States this year has had at least horse, bird, and/or traps contained, even though not every state has had human cases yet. Proven human cases.
Gotcha. Okay, well, thank you. So that will conclude our education presentation, and we'll move on to new business, and we'll begin with travel authorizations.
We have 3 in the packet. This is our AOHC, it's the Health Commissioner Association's fall meeting, and Carla, Dr. Genowine, and I will be going to that, and it's in the packet.
Anything else?
Any questions for me?
Any questions about travel authorizations or what the conference is?
I did notice there's no travel cost listed for Carla.
Well, we usually share rooms.
Oh, okay.
Yeah.
Okay.
Yeah, I know, like, she's a cheap date. Normally, when we go to this conference, the meal is now like $20 in that, if the Monday night, so we didn't have to do a meal, cause that's in the conference fee. And then Tuesday night, we have 1 meal, and then we just share the room, so. And then we usually, we'll either drive up in the car, or I'll put it on gas mileage, depending how we do it with the gas mileage, so it's not.
Until we can't share it. We should start snoring.
I know.
All right, any other questions or any other discussion about travel authorization? Do we have a motion to approve?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Any more discussion? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes?
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yeses have it, motion passes. Thank you. Okay, so now, the second item under new business, we have 7, is the second reading of the MVH ordinance number 2024-01 by title only for food fees, and my computer's working, so I can actually read this now. So we have, again, an ordinance amending fees for the licensing of food service operations, mobile food service operations, temporary food service operations, vending machine locations, retail food establishments, mobile retail food establishments, and temporary retail food establishments. Do we have a motion to approve the ordinance?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? This one seems pretty straightforward coming from the state, correct?
Yes, yes. The only, like I said, the only changes or updates, minor updates between the first reading and the second reading was in section 3 and 4. The law department made some, just minor language change
Okay.
updates, but nothing significant.
All right. Okay, well, is there any further discussion, any further question? Okay, hearing none, we will proceed. Oh, wait, do we have 3 readings?
No.
No, this is it.
We have 3 readings.
We have 3
Well, we
readings.
have 3, but yeah,
This is the second reading.
this is second reading.
Okay, so we do not have any action today.
No,
All right, so we will
Especially-
continue. Let's continue then. So the second reading, the third item is our second reading of the MBH ordinance number 2024-02, by title only, again, pool fees. So let me find that really quickly. And it just says, an ordinance amending the fees for the licensing of public swimming pools, public spas, and special use pools. Do we have so we had a motion, but that motion just dies on the floor, correct?
Correct.
Okay, so that's why we just read. So is there any discussion? There's no action to be taken today. So let's see if I have anything here. I'm curious, this one is also gonna have a third reading, so I guess I have no questions. If there are no further comments or questions, we will continue on. Okay, so the fourth item on our agenda here is the approval of the MBHE resolution number 2024-01 for air pollution control regulations and declaring an emergency. So let me go ahead and find that really quickly. So is there a motion to approve?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion about this resolution?
I just wanted to mention, this is an existing, contract, that we had, we actually passed it in February. This is with the Hamilton County Environmental Services, to support air quality services and abatement for the health department. It's just an updated contract. They wanted to add, new pollution control standards. So they actually updated the contract with the entire region.
Okay, 'cause that's what I was wondering.
Yeah.
Why is this happening now? Why is it an emergency?
Because they just wanted to get it done. We've had it for a couple of months. The law department has had it, so we just wanted to get it through.
And the
And they got-
contract normally is in place, but when they updated the standards, you remember when we were at the Suncoke
Mm-hmm.
meeting and they said this was coming down the pike, were those new standards? And so they just want a new contract in place
Right.
with the new standards in there. And we will be voting on this one. This is not a.
Yeah, as an emergency, we have to vote on this today. Okay, do we have any other questions or comments? Hearing none, we will proceed to vote. Ms. McDonald, can you please call the roll?
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
Okay, the yeses have it, and the motion passes. The fifth item under new business is approval of MBHE resolution number 2024-02. It's, let's see here, should I just go, it's a regulation regarding articles, requirement to cease use and declaring an emergency. Shall I read the title again? So, a resolution authorizing the city's health commissioner or any registered environmental health specialist or environmental health specialist in training to take action under Ohio Administrative Code sections 901-3-4-12 and 3701-21-28 regarding articles requirement to cease use and declaring an emergency. As an emergency, we will be voting on this. Do we have a motion to approve?
So moved.
Is there a second?
Second.
Has been properly moved and seconded. Is there any discussion about this resolution?
This is an existing, resolution. We already had, I think, back in '01, to, have facilities cease use of equipment if necessary in retail food establishments. There was a code update, effective September the 5th, that allow us to use these same powers in food service operations. So this would be, an example would be if we go into an establishment and they're using some equipment that could be a significant public health issue, we would require them not to use it or cease use. So
What-
we would tag the equipment.
Oh, this is combined then? So this is the one about tagging?
Yes.
'Cause I was gonna say, like, yeah, what would an example be? Like a piece of, what would that look like?
Well,
For example?
a piece of equipment that's not approved, or a piece like a knife, or something that could get into food. Actually, here's one. This is a piece of equipment that they used. It's a cement mixer
Yep.
that they were
That was
preparing
Bill.
food in.
Oh, there we go.
So, that's a bigger.
problem.
So if we go there and we see them using that, we would ask them to please use. So,
Because it's not prepared for food use,
it's not,
right? Yeah.
it's not
Oh,
prepared.
They could use a different paint, they could,
Yeah,
yeah.
yes,
Oh.
yes,
What are they mixing?
chicken. It's chicken in there.
It's chicken and
Yeah,
ice.
yeah.
Oh, that's chicken.
So,
that's
it,
creative.
yeah, so it would be any type of equipment that's not approved for use that could cause significant, public health issues.
Does it happen often?
It doesn't happen that often.
And it seems like because there was a change in code, we have to approve
You,
this.
you don't have to.
Well, I mean, that's why, in order to be able to do
To
it.
do, in order for us to use those powers, the board has to approve us to use the powers.
Okay.
The state gives us the powers, the ability to do it, but the board has to approve
Approve
it.
it,
Yeah.
I got you. I was like, well, if we can do it, why don't we just do it? We're
Yeah,
gonna do it.
we have to get approval to do it through the board.
Okay.
And like I said, we have it in FSO, in RFEs, they're just giving us the ability to do it in food service operations. Normally, when we ask facilities not to use a piece of equipment, they'll usually comply.
Mm-hmm.
I actually haven't seen them not comply, only once, maybe once. You go back and they're continue using the equipment.
And at that point, what happens? It goes to court?
I would tag the equipment and then it could possibly go to court and we could call them in for a hearing, an administrative hearing.
Okay. All right, is there any,
Court could go to court, yes.
any further discussion or questions? Nope, okay, so we will be voting, hearing no more discussion. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zolik?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
All right, the yeses have it and the motion passes. The sixth item under new business is the approval of the MVHE resolution number 2024-003, which is embargo of food and declaring an emergency. I'll just read the title in its completion. A resolution authorizing the city's health commissioner or any registered environmental health specialist or environmental health specialist in training to take action under Ohio Administrative Code Sections 9013-4-15F, as in Frank, and 3701-21-27 regarding embargo of food and declaring an emergency. As an emergency, would you need to take action? Is there a motion to approve?
So moved.
Is there a second?
Second.
Having been properly moved and seconded, is there any discussion? So again, this is also,
So-
yes, go ahead with the staff report.
So this one is an existing, resolution that we have in place, so it's pretty much just language cleanup. So we have the ability, the board has given us the ability, to use embargo powers. So it's just pretty much language cleanup, and this is in FSOs and RFPs. And it's pretty much similar to this one. Like, for this facility, we asked them to discard the chicken because it's made in a piece of equipment that's not approved. So theoretically, we could have, if they decided they didn't wanna throw away the chicken, which they did, we asked them to discard it. If they wouldn't discard it, we would embargo it, which means we would tag it and take them to court and see why they would not discard the product, but they should discard it, which they did.
You can't take it, like, you can't, like,
Seize it?
remove it? Yeah,
We
seize
can,
it.
we can remove,
Okay.
yes, we can. We can discard it as well. We have that ability to.
Because it seems like
But
something
we
like
would take-
chicken, going to court.
I know, yeah.
Yeah, yeah.
Yes.
I remember on the scene, and when Carla does festivals, sometimes if the chickens are out of, she makes them discard it and then pour bleach over it and making sure they don't use it again when we leave. So they usually.
With
make
this
sure-
situation, we actually ask people to discard food quite frequently if it's out of temperature, or contaminated. So normally we don't really have an issue with it, but you could. When you start, we ask them to voluntarily discard it. But when you start, you go in there and you have a lot of packaged product, thousands of dollars. And they make it to the point where they don't wanna discard it. So you wanna have that ability to embargo that product.
This is also, the one talking about best use by dates, correct, as well?
The only, use by dates that we have the ability to control is baby food and infant formula.
Yeah. And I guess just to clarification, best used by dates. I've heard people say that it's just a recommendation.
It's a quality,
Okay,
yeah, we
it's
don't-
best used by the
Yes,
state, but
yes.
if you don't mind quality being bad, go ahead, like that
Right.
kind of thing, okay.
Right.
Is that why it's only for baby food and formula?
Well, you want, with the baby food, you want that nutritional value, that could, I believe that could be, over time, it could possibly be depleted out of the product.
All right, well, thank you. All right, any more, discussion or questions? Okay, hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash? Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
The yeses have it, and the resolution passes. Okay, the last item under new business is to approve the agreement to provide air pollution control services, Hamilton County Department of Environmental Services. So we have the agreement here. Do we have anything as far as the staff report or any discussion on this? No, nothing to, okay. So do we have a, motion to approve? Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? Any questions? We sort of talked about this a little bit earlier. So you had said that we already used this. We're just cleaning up some language. Okay, let me see if I have any questions on here. I have a question. How do we test our schools for air quality?
We don't.
We don't?
We don't.
The school does.
I'm not sure if the school does that or not.
Didn't we have this discussion before?
I think you were wondering.
Yeah.
And we have no authority over them, we don't have any. For the schools, I don't know what the schools actually do, air quality.
Okay.
Yeah, we don't have any authority or regulations as far as the health department would go. And the schools, most of the schools are new, doesn't mean they may have problems, but I think all of them except Amanda, is that correct? Are new? So they should have some air quality things in place with that, the filters and air conditions and et cetera, but we can check with the schools to see if they test their air quality, but I'm not sure if
Yeah.
any of the schools.
We do the environmental inspections, but we don't do any air quality.
Air quality.
We would do air quality for buildings like the community center? No? No. Okay, just wondering.
Or this building.
Oh, gracious.
Yeah, so, I mean, now, we had an air quality person come in and speak to us, and they have canisters. You can request them to put canisters in the room, and they collect the air or whatever, so she said that she would come out to do that. It's a free service if anybody was interested. You remember when we had her come
Yeah.
into the office to do it in service? Yeah.
That's
So
for
we
any
could-
citizen.
That sounds good, especially for older buildings, like
Mhm.
this building, like the community center. So how would one go about requesting that?
I think you just call them, make a request.
Yeah, they have.
They
a
bring it in,
num-
yeah. So
Why
give us
would you
a-
do that?
Why would you do it?
Yeah.
People sometimes do it if you're saying the same type of illnesses
I
over
mean,
and
are
over.
people getting sick here? or
Yeah,
they-
like if it's they call it sick buildings, and so sometimes they do it just to see if there's anything that's picked up. Often it's not, but that's why people would do it.
Also, I guess to see if there's anything you can do to improve the air quality, like filters or anything like that, or getting rid of mold or something.
I think the biggest, cause one of the concerns, I think when we had Jared's Law, in schools, they did radon testing, but that
Right,
was
that was
the
the
only
only-
thing that they.
Okay, any other questions or comments? Hearing none, we will proceed to vote. Ms. McDonald, can you please call the roll?
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yeses have it, and that agreement is approved. Thank you so much. That concludes new business. Next item on the agenda are our reports, so we'll begin with our health commissioner.
I will try to be quick, as you guys can tell, I'm kind of snotty.
Air quality.
I hope it's allergies. Can I get COVID again, that close to my last COVID? So I'm trying to stay over here. I know, right? I'm trying to stay over. The mayor has been involved in this too. It is and Mayor, correct me if I'm wrong, it is a 5-year strategic consolidated plan that HUD does to strategize how they're gonna move forward in their next 5 years with housing. It was a Butler County meeting last Tuesday, and it was like 7 of us there, out of the whole county. And it was a public meeting, and I'm like,
Oh, well, this is for the community development
this was
block
the,
grant.
yeah, I'm sorry, for the Community Development Block Grant. This is,
CDBG.
yeah, see, yeah,
We
Right.
we have two, there's a Butler County CDBG,
it's crazy,
and then Middletown has our own as well.
yeah.
So we had 2 public meetings last week, one on Tuesday that Jackie went to.
Right.
I was not able because we had a council meeting. And then, there's
Virtual.
one on virtually on Thursday that I was able to attend. Jackie was also there along with other people from Middletown,
36 surveys from the whole county,
the whole county.
because that survey's out, and I'll send you guys a survey. I think I may have sent it to you, but I'll make sure it's a link in there. This is supposed to be a strategic way to talk to the community about what housing issues are out there, and they send this link out to stakeholders, they say, and stakeholders are supposed to get it down to the nuts and bolts. 36 responses. So Thursday, I had invited some Middletown people to kind of really be on the Thursday's virtual meeting. So we had more of a representation. And then we met last night, the mayor and I and some other people, to say how we can get this word out. Because Middletown's Community Development Block Grant survey is open until the end of this month. In that, they say, what are the housing issues? Is it enough affordable housing? It's just different little questions, and it's not a long, that we were looking at the survey, some of the questions, we didn't understand them. What do they say, accessibility? They have some questions you don't understand, maybe what they're asking or whatever, but it's a short survey. But we are gonna try to have a big group of community people come out on September 24th and kind of walk them through the survey to get more survey responses. I'll send it out to you if I haven't, but I'm not sure if I have, but I'll send it out to you again. It's just a link, and you can dot really quick. It is really a quick survey. But just getting more participation in the community as far as housing would go.
Yes, and specifically, the Community Development Block Grant is for low and mid-income neighborhoods. So that's what we're specifically looking at, but it's for the entire community. Like what do you think, and part of the survey has us prioritizing, like high priority to low priority, or even not applicable, what we need to deal with in the city of Middletown. So it is very useful. And again, that survey can be done until September 30th. We are having a community meeting at the community center on the 24th, just to try to get more responses. We're also gonna be publishing this on the Facebook page, maybe the website, trying to get this out to as many residents as possible. So if you're able to pass this along to your spheres of influence, that would be very helpful to have people who live here to fill this out.
What I would hope is this is a piece of the housing policy that City of Middletown will have, so we can make sure we have a diverse selection of housing in our community. There is also, when people look at it, let's put the homeless aside, those that completely are unhoused. It's a lot of people that can't afford housing on both ends, single parents, new graduates from college, elderly on each end. And if we're building a lot of $350,000, $450,000 homes, that leaves out that large swath of population that may need housing. And it could be any kind of housing. We were looking at our elderly housing units are not just really kept up nicely. And so like if you look at some of the ones around here, so if we were 70, where would you move if you could no longer stay in your home? Do you have to move outside of Middletown, or is it somewhere you can move where it's safe, accessible, one story, etc.? So it's just that whole housing stock in your city. And
Yeah, I was gonna say this, so this survey helps us determine what the CDBG funds will be prioritizing over the next 5 years. And then every year, there's an action plan that gets done, so we'll
That's
also ask again, like this year, of these categories, what do we wanna focus on? So it's very useful, as the more people can get involved, the better.
I'd like to thank the board for allowing me to go to that conference in Atlanta called Policy Link. It was a very interesting, different type of conference, but it is what it sounds like. It's a policy link. They took people across the United States that dealt with transportation, homelessness, housing issues, addiction, drugs, anything that, like, it's like those hard social stuff to deal with. and then how important it is to build policy, why we're chasing. Sometimes we fix things, but we don't put policies in place to make sure it doesn't happen. So it was linking people together to kind of network with each other, come together. It's done every 2 years. Interact for Health sponsored Deanna and I to go, because we were Middletown Connect grantees. So they sent some of their grantees to it, and it's every 2 years. Very nice conference, more information to come. Mayor and I were talking about how we can start just doing small little policies. The board is a policy-making board, so if we ever see something where it's in our realm with health, and we decide that everybody, I'm just making this up, should have fluoridation in the water, that's a policy, and we did that for public health. Or so, it's anything like that that we can see that could maybe help people, where it's a policy that's in place, and you have to opt out. Those are kind of nice, to make people safe. And so, think about it as we go as we go along the health road. If we see, gosh, how hard would it be to have lighting at every traffic light where kids cross? And that could be something that we could work with the schools, develop a policy that is just something that's done, and we don't have to wait for car accidents. I'm just making that up or whatever. So it's kind of neat, because you just don't think about, you always think about doing the action and not putting the policy in place to do that. So that was the last thing. Overdose, I just sent this out. We just got this report yesterday. We had a large spike in overdoses, and we just got another one in the coroner. So it was 7 over last weekend, and 4 of the 7, I'm not sure about the latest one, were Middletonians. 3 of the 4 were women. That's unusual, because usually it's men. And so we'll be watching for that spike again for those anomalies. If you looked in the packet, some of the 3 of the indigents that we had done were, I think, overdoses. So again, that could be another reason why you can start seeing things go up as far as your indigent costs if they're overdoses, and if they're long-term drug, users or whatever. I think there were opiates and barbiturates, I think, a combination of some of the drugs that's out there. So emergency room said they saw a spike as well, because remember, we're only getting the deaths, and sometimes they'll look at ED data, and they'll look at EMS runs to see how many people that may not have been successful. But those are just the actual deaths that was seen over the past weekend. I think it happened the 4th, 5th, 6th, somewhere around there. It's in the report. Good news, upside, Robert Sunny Hill had a groundbreaking Monday. What day is it today? Tuesday. So that was yesterday. Yesterday, that's exciting to see things move like dirt. Yep. And Walk with the Doc is the next Walk with the Doc. Did Dr. Zalet and Dr. Geneline get my email prompting you to maybe come out and walk?
I don't think
You didn't pay attention to it?
I don't look every day.
Okay, well.
But I don't think I did.
So anyway, Walk with the Dog, well, a lot of fun last time. It is the 3rd Saturday of the month. The next one is the 21st of September, starts at Rosa Parks. It was a beautiful day last time. And they just need a doctor to show up and just come with anything they want to talk about. It could be diabetes, it could be heart disease, it could be something, just a quick little snippet, and then we walk. So that was a lot of fun. So the next one is 9/21. If you are interested, I'll get you in the link just to do some of those walks. You sign up for them, it'll be your great public service. And Hispanic, Middletown Connect. Again, I'll send that invite. I have a star here to make sure everybody gets that invite. Middletown Connect will be doing an annual updated meeting. It's at Miami University from 8:30 to 10. Yeah. And they serve breakfast, a little bit of breakfast, but they just tell you everything they've done, everything that they're doing. This is only for policy, when I say policymakers, we set the HIP team is people that can make policy change or give 50,000 or more. So that's the people that we're inviting. The community partners are the ones that actually do the work. The HIP partners, health improvement partners, are the ones that can make the difference in the change. So you guys are policy making changers, so.
What date is that?
That is Friday, September 27th,
Oh, okay.
8:30 to 10. Deanna should be getting those invites out.
What is on
Very
the,
soon.
what's on the 18th then? Is that the community?
That's the ambassador community.
Okay.
Yeah.
Oops.
last but not least, I keep putting on the front, be looking forward, oh, I'm not gonna say, it's another one. Saturday Comic Expo, first one ever in Middletown. I have my grandsons volunteering, and it looks like it's gonna be so fun. And it looks like they're sold out, and it looks like it's a lot of activity. But for those that are into comic cons, or all these cons, there's all these cons, which means conferences. But they say, when we were leaving Policy Link, it was a Dragon Con. You guys, these people were all in these masks and these big swords and plates and stuff. I was like, what the heck is happening? So it's kind of cool, because the town gets, you know, surrounded by these really crazy things. And kids are really into it, and adults are too. I found out adults are too. If they talk a different language, you just gotta go with it. Cause I'm like, what is that? What is that? They have all these games, and it's just really neat. But Mr. America, I'm probably giving you the wrong people. Iron
Captain
Man,
America.
Captain America, Iron Man, all these big comic people, right? And they're supposed to even have tattoos. I don't know if Carla's got, but they're gonna have a room where they're giving live tattoos. And it might be comic things on there. That would kind of be neat. And magicians, and it's just supposed to be a whole lot of fun. It's very affordable this year. Kids under 12, I think, is free.
Wow.
And then it's maybe $10. Most Comic Cons, or if any of those other ones, are up to 700. I mean, it costs a lot to go on too. So that is this coming Saturday. And so at Miami University. And so, and I think it's from 11 to 7.
I think it's 11 to 8.
8,
Yeah.
11 to 8.
It's a
yeah.
long, all-day event, and
It's all day.
it's usually just good family fun, and that's usually what it is.
And it's big
nice.
following.
Yeah.
I can't believe how many people. And then last but not least, Hispanic Festival coming up. We're getting information on that, still working. That is September 28th.
Yep, 12 to 4.
We'll make sure, Amanda helped me remind, to put all these activities on your radar to send them out to you.
And one of the reasons that they wanna have the Hispanic Heritage Festival is to get information out to populations, so the health department will have a booth, correct? The
Mhm.
health department will
Yep,
have a
we'll be
booth.
there.
Yeah, so it's just really a way to reach the community in another fun way, and the food is excellent, so if you like to try new things that you've never had or seen or can't pronounce, it's a good place to go.
That's it.
That's fine. All right, well, thank you so much. Okay, the next report, medical director.
Our reportable illnesses for August. Chlamydia was 22, gonorrhea was 8, hepatitis C 5, hepatitis B 2. We had 1 pertussis, 1 invasive group A strep, 1 Candida auris, and 1 Campylobacter, 1 CPO, carbapenemase producing organism. And that's all I have.
All right, thank you very much. Any questions or comments? Nope, all right, we will move on to our Director of Nursing.
Previously mentioned, we will be at the festival on the 28th. Myself and our FAB coordinator, and as well as Stephanie, who's going to be helping out not only with the food inspections with the sanitarians, that when she's done doing that part, she's gonna come and help me in our booth so that we can more effectively communicate with the population, as hopefully they will interact with us. Along the lines with the increased overdoses, unfortunately, I did just yesterday receive a new shipment, new supply of Narcan for the community. So if there's anybody who is concerned about a loved one or themselves during recovery needing some assistance with coming out of an overdose, we do have Narcan available for the community. They just have to come in and see me, go through brief training, and then they will be supplied with a 2-dose Narcan kit. And then the last thing is we did have a site visit with the Ohio Department of Health in regards to our vaccine program, which we discussed last month with our adult contract. And we got the all clear. They approved our site for that. So first vaccines that we should be getting in hopefully within the next month prior to next board meeting should be our adult influenza. So look forward to hopefully vaccinating a couple of y'all. Next meeting, if you haven't already flown out and gotten vaccinated.
You're gonna have it at the meeting?
I'll have it for after the meeting,
Oh.
yes.
Okay. Well, thank you.
That's it.
All right, well, thank you very much. and, we have our environmental health director next.
So far for August, we've had, received 2 sets of plans, we approved 1 set. We issued 7 licenses, and we had 2, facilities with the change of ownership. We had 1 temporary, at Middletown High School, Meet the Fall Sports. With our T21, all our facilities are now licensed, finally. And we're working on the follow-up inspections, and again, we have a total of 70 facilities. And we have 41 follow-ups to do that were non-compliant. We do have the state, Ohio Department of Health, Ohio Department of Agriculture is in doing a survey, and she mentioned that she should finish up. She came yesterday, she should finish up by, this afternoon. She did mention that so far it looks like we've done a very good job with, documenting and follow-up inspections. So we'll just wait for the report to come in. We have Ohio Department of Health, which is coming in to survey our program at the end of the month. So 2 surveys this month. Again, I want to mention we had a food code update. They usually look at the rules and update the food code every 5 years. And of course, like I said, one of the major updates was the tagging of equipment and FSOs. Another major update, which we will notify facilities. The facility will now have to disclose to the public if they're using allergens within the facility and ingredients. So you'll probably start seeing that on table tents, menus, and things of that nature. So, and I believe they added an allergen to sesame to that. I think we have 8 different allergens, major allergens.
Is that for all food establishments?
Yes.
Restaurants? and
You're at restaurants, yeah.
Everything?
Yep. And again, Hispanic Festival and Comic Expo, we will be attending all day, for those. Other than that, I believe that's it.
All right.
For Barbara.
Any questions or comments? All right, well, thank you very much.
One
Yeah.
more thing, I did, if you look at the smoking report, we were able to, the state was able to collect the fines for those 2 facilities.
Oh, yeah.
Yeah.
Oh, wow, yeah, I saw that.
So that was, we received 90% of the fines, and the state receives 10%, so.
That's wonderful.
I'm
Yeah.
surprised they paid it.
Yeah, they did pay it, it came in.
Going to Hawaii.
Yeah.
Going to Hawaii.
Good job. All right, well, thank you very much. Okay, so the next item on the agenda are our board member open discussion.
It's not a discussion, I just have a question, I don't understand it. It says the vital statistics, and it says birth certificates, death certificates issued, and then, or filed, and then they say issued, and that's like 3 or 4 or 5 times.
Filed means they were born. So if John Doe was born on July 1st, we file that certificate. And issued mean mom comes in and get 5 birth certificates from John Doe. So that's the reason why it's.
So they
So-
give out these certificates to all
Yeah.
these different people, is that it?
Right, so
Oh,
we
I see.
file every birth and every death
Oh.
for the count of birth and deaths, and then we issue multiple birth and deaths on people. So if they're getting their driver's license, if they're
Okay.
retiring, you may get your birth certificate multiple times, and those are
I
issues.
gotcha.
Yeah,
Okay.
yeah. But you know what, I always look at that, we like birth to kind of
There's
be more than death.
There's
and
more
it's not.
deaths than births here,
Yeah.
yeah.
Our population, that's what's always scary.
I
We would
noticed
like
that.
it to be, like, more babies born than deaths, but anymore is more people dying.
That's everywhere apparently,
Yeah.
see it all the
Population.
time.
Any other questions or comments or discussion? One thing I wanted to mention.
That's a good question. Every time we look at that.
I see it.
gets, people like thinking, what is this, how does this
I
make
don't
sense?
understand
How does
how.
that
Yeah,
work?
right, that's a good question.
Jackie had a nice quote in, one of our newspaper articles in here about humanizing, addiction, people with addiction, talking about addiction as disease. And that's something I always I never really got how addiction was disease. It's hard for me to grasp that. But I was sent a video that people dealing with addiction said was excellent. I wanted to kind of share that with everyone and maybe see if we can utilize this video in some way, because I watched it, it's an hour long, it's so succinct, it flies by, it uses great data and research and explains it in a way that I can get, and I learned a lot of things too about how, for example, no matter, once that gene is turned on, however it's turned on, any drug will hit those areas. So even if you are somebody who, example, likes cocaine and makes you hyper and stuff, but if you say, well, I'm in recovery for cocaine, but now I'm gonna be drinking alcohol, it's the same thing, so you're actually not in recovery. I didn't realize that. So I just thought it was a kind of like a wonderful video, maybe a discussion that we could have. I think September is Recovery Month as well. October is another month, May is Mental Health Awareness, and so I thought maybe this would be something that we could share somehow to kind of get the word out, just to educate people.
Yeah, did you get that to us?
Not yet, I have it
Yeah,
ready to
that
send
would
out.
be, that would be good, cause we can even get it to Clayton.
Mhm.
I always tell people, behaviors is a choice, right? But whether you become addicted, a lot lies in the brain. It's just some people, when I was teaching pharmacology in addiction, people can go to a racetrack and say, I'm gonna bid on this, and then they're done after $50, $25. And other ones might just really get into it and they spend $200, $300. And then people go back week after week after week and completely lose their check, knowing they have mortgages, rent, kids at home. And so something happens with the brain that gets hijacked, and it's not just poor behavior, it's something that happens in the brain. And so, studies show it all the time. So, and everybody, why some people become addicted and others don't. And some people are addicted on different things, shopping. But sometimes it's just not as deadly or as horrific in your, family.
Or
Eating.
socially unacceptable.
Yeah, or socially unacceptable,
Yeah.
or legal. So,
Yeah.
it's just a lot of things that tied in there that is interesting.
Yeah, and that was the thing, just understanding addiction as disease. And one of the things that was salient to me as well from this video, it was the point of, say you're in the desert and you've been there for 5 days, you haven't had water, and then somebody offers you water, but they say, but we're gonna take your kids, we're gonna take your house, would you take that water or not? And you might take that water in that moment and deal with the rest later, right? So it was kind of like just trying to help people understand what this is like. Yeah, there's a choice, but really is there? And once that gene gets turned on, that's different for everybody. So I thought it was very useful, and maybe something we put on the website, I don't know, for the health
Something like that,
department,
or just
something,
like that.
just to talk about it, just to put it out there for people to see. That was all I had for general discussion. Does anybody else have anything they wanted to add? Nope. Okay. Well, then we are able to adjourn this meeting at 8:42 this morning. The next meeting is scheduled for October 8th, 2024 at 7:30 a.m. Thank you.